The LIFEPAK 15 monitored defibrillator can be used for either demand or non-demand pacing. Demand pacing is used for most patients, so that's what we'll show here. First of all, before you start pacing someone, always consider the need for patient analgesia or sedation. Okay, connect the ECG leads to the patient. You need to do this for demand pacing, so the pacemaker can see the patient's own beats and deliver pacing pulses only when needed. Also, although the quick combo electrodes can be used both to monitor ECG and for pacing, they can't do both at the same time. So, here we go. We have the ECG leads on and lead 2 is displayed. Now we'll place the therapy electrodes. We'll use anterior-posterior here. You can use either the anterior lateral or anterior posterior position. Prep the skin as we showed you in the ECG monitoring section. Place this electrode with the heart over the left precordium, just below the nipple. It's important to put the electrode with the heart here rather than on the back, because if the electrodes are reversed, it might require a higher current to achieve capture. Place the other electrode on the patient's back in the infrascapular area, like this. Be careful to keep adequate separation between the ECG electrodes and the therapy electrodes to minimize artifact on the ECG. Press pacer. You should see sense markers on each QRS, like these. If you don't see sense markers or they're on the T-wave, adjust the ECG size or select another lead until you do see sense markers. Now, press rate. Press the up or down arrows to get the rate you need. Press the current up arrow repeatedly to increase the pacing current. Now you can see these pace markers, indicating that pacing current is being delivered. You should notice the patient beginning to twitch. Increase the current until you see electrical capture. You'll have electrical capture when each pace marker is followed by a wide QRS and a T-wave, like this. It's important to be aware that the average current needed for capture is between 50 and 100 milliamps. The final step is to ensure that you also have mechanical capture. Palpate the patient's pulse and obtain a blood pressure. Pulse oximetry may also be useful. Observe the patient continuously while actively pacing. The patient's response to pacing therapy may change over time. If you need to check the patient's underlying rhythm, press and hold pause to temporarily reduce the pacing rate. Release the button to resume pacing at the set rate. To stop pacing, press pacer. A few more things. During pacing, you always see dashes up here instead of a heart rate, and the heart rate alarms are disabled. It's important to frequently assess the patient for mechanical capture. If an ECG lead comes off, pacing switches to non-demand, and the monitor shows a dashed line for the ECG. This means the pacemaker paces 100% at the set rate, regardless of the patient's underlying rhythm. To re-establish demand pacing, reattach the ECG electrode. If you're increasing the current, but the patient is not twitching, check the patient's heart rate. Remember that the pacing rate needs to be set higher than the patient's own rate for pacing current to be delivered. If you're pacing and the patient needs to be defibrillated, press charge. Pacing stops automatically. Proceed with defibrillation as described in the manual defibrillation section. And that's it for pacing.